So glad to be graced by Elder Diana Day. I'll be a host today, but I'll give the first word to Elder Diana Day. Thank you.
Yeah, thank you. Saguli, everyone. My name is Diana Day. I'm from the Oneida Nation, which is part of the Iroquois Six Nations Confederacy. And I've been transplanted out here as an uninvited guest for quite some time, since the early 80s. I came out here, and I remember I often tell this story because it's so touching that uh to acknowledge the Coast Salish, the Musqueam, Squamish, and Tsleil-Waututh people who have been here for thousands and thousands and thousands and thousands and thousands and thousands and thousands of years. So we have to remember that the territory that we're on is unceded territory, and that it was never handed over to government or to people. And so we're very, very, very honored. I'm very honored and very privileged to be living in Vancouver among all the beauty that we see here. And when I first moved here to Vancouver, I followed my sister who was out here, and we had taken a train ride from Portland up to Vancouver, and it was so beautiful. And I said to myself, I'd like to move back here one year. And so 2 years after that, I did. I moved back, and have been doing lots of different work with lots of different organizations and people. And right now, I'm the founder of Indigenous Women Rise. It's a new organization that we're supporting Indigenous women and lifting Indigenous women up in BC. So I remember coming back to when I first came here, and Vancouver had been celebrating just its 100th birthday. And I was at Queen Elizabeth Park, and I was looking out, and at that time you could see the city view from Queen Elizabeth Park. And I thought to myself, wow, in just 100 years, all of this was created in just 100 short years. And just thinking about the displacement of the people who once lived here in perfect harmony with nature and had food security for thousands of years, and were housed for thousands of years. So just thinking about the devastation that's happened to the First Nations people whose territory we are living on, and how it's important to acknowledge and to recognize them and to pay respects to them as well too. And I know that some of my dearest relatives are on the downtown east side, and that everyone is struggling with their own mental health issues because of the colonization has affected everyone differently. And so we have people that are on different healing paths and at different levels of their healing, different stages of their healing. And we still have a lot of people who are hurt and who are hurting. And so we need to remember them in our prayers all the time. And so just think about that. So the first song that I'm gonna sing a song with you guys, for you guys, and the first one that I'm gonna sing is an a cappella song, and it's about this land is native land. So important that we reclaim the land, the territories, and that we let people know that this land is native land. So this song is an adaptation from another famous song that you'll recognize the tune to, but I think it might probably the first time that you've heard it sung this way. So I hope you enjoy it. This land is native land. This land is native land, from the Iroquois to Coast Salish Island, from the Tule River tribe to the Navajo. This land was stolen from my people. This land is stolen land. This land is stolen land, from where our buffalo roam and where our salmon swam, from attempted genocide and assimilation. Colonization stole more than you'll know. Now I'd like to sing the Coast Salish anthem. to recognize and honor the Coast Salish people whose territory we're so blessed to live upon. And I want you to remember all the people that you see on the street who are not as lucky as the ones sitting in this room, as fortunate as the ones sitting in this room or online. Just think about those people. Send your prayers out for healing, for love, for those people who are so needing that. Now, Uncle, thank you for letting me. Oh, he loves he loves hey. Oh, he loves Elohim. Ha, Hela, ha, hi, 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 la, ha, hey, hey. Oh, he lo, he lo, hey. Oh, he lo, he lo, hey. Ha, hey, la, ha, ha. Hi, 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 la, ha, hey, hey. Ho, 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 eh, la, ha, hey, hey. Woo. Uncle, thank you, Daniel, for inviting me here, and I hope that you have a wonderful day, a beautiful day, and I hope that you bless everyone that you touch, and because we are medicine for each other, we're medicine for each other. So just remember that as you're out and about, be medicine for the people that are out there. Uncle.
Thank you, Elder Diana Day. That ties in so well with our topic today on social health. And without further ado, we will invite Professor Andrew Wister, Director of the Gerontology Research Center, to say a few words of welcome. Thank you so much.
Good afternoon, everyone. My name is Andrew Wister. I'm the director of the Gerontology Research Center at Simon Fraser University. And I was just informed that I had a student, Linda Day, who's here now. Maybe, I don't know, everyone can't see you right now, but nice to see you again, Linda. Linda was a master's student of mine. I know that was many moons ago, but that was a wonderful experience. And I recall that Linda's MA thesis was actually on the experience, the residential school experience on rates of health, in particular tuberculosis. And we found some very strong findings on that. So nice to see you again, Linda. I know we spoke by phone. In any event, I want to thank all of the people who've been part of this project, led by Daniel Gann, Aaron O'Day, Claire Wang, Sarah Key, Margaret, Sheena, and Richard, DW Richard, is it? Or Sheena Richard. Sheena Richard, excuse me. So welcome everyone, and I'm hoping that this will be a rewarding experience. We're going to be having a number of activities that are going to engage you as members of various communities in and honor diversity and honor working together to address various aging-related issues that we face in today's society. Especially, if I may add, after this, during this rebuilding after the pandemic, which really revealed a number of very important and problematic areas that we have to address. So I'll turn this over to Daniel. Thank you, everyone.
Thank you so much, Professor Andrew Wister. Let's give Professor Andrew Wister and Elder Diana a hand. Yeah, and that again ties in really well with our topic today. Of course, we were talking about rebuilding community post-pandemic, and so we have two projects to share with you today, and we are just going to share screen now. Thank you so much, Sarah, for being so capable and dealing with all this tech issues that goes beyond my head. So my name is Daniel. I'm a postdoc. I'm a settler here in the beautiful lands of British Columbia, and I'm really thankful to all of you for having me and for engaging with me. All the partners that we have on screen now, so many of you supported in so many different ways, and also especially our co-organizers. So thank you, and also thank you to our funders. So just a brief overview of today. We know there's been some delay, but our aim here is to explore the possibility of enhancing linkages across the health and community sectors for seniors' well-being. And we want to facilitate discussions, and we know that many of you are joining as leaders of different community organizations that we have engaged in some preliminary conversation with. SFU as a research institution, we may not be able to do everything that you do, and we really admire you for the work that you do, but we love to come alongside you. And if there was more time today, our director, Professor Andrew Wister, would love to talk to you about the MyTex funds that are available. So please do reach out to Professor Andrew Wister if you have interest. We're also going to introduce some available tools. We have one of our web app provider here, Joao. So if he approaches you to talk to you about scanning something for an app, yeah, just don't feel shy. Try it out, and we'll also be showing some of we should also be showing that for people who are joining online. Thank you. So after this about welcome and background, we will share some innovations. We will try to keep it short so we have some time for Q&A still. Then we will take a break, hopefully at 2:05 or 2:10, and then we'll go back to our concurrent breakouts at 2:15. We will make sure there's at least 5 minutes because Elaine Book from BC Brain Wellness will be able to host some questions that our online participants will have during the break. It's a wonderful BC Brain Wellness program, and you can find out more also in one of our upcoming page that you'll see. Lots of QR codes today. Get ready your phone to see some of those links. So now, without further ado, I'll go into our research findings, which I believe is the main reason you're here. All right. So without looking at the slides now, I'm giving away my answers. My question to us today is, how would you describe your neighborhood? So if you take some time to think about your neighborhood, how would you describe it? Is it green? Is it beautiful? Or does words like caring and connected comes to you first? Yeah. Those are the questions we asked 150 seniors across BC during COVID, and we found that more cohesive neighborhoods cope better. So we asked you these questions when you registered for this event, and some of you, I think we are split quite half the middle. Some of you said that people who are neighborhoods that are more affluent cope better, but that was surprisingly not our finding. And we dug deeper with the help of Erin into comparative thematic qualitative analysis, and also Claire, one of our research team, and we found that more cohesive neighborhoods cope better because of mutual support. So would you say your neighborhood is cohesive? Before you answer that question, we want to let you know a little bit about our methods. So 1 year into the pandemic, we we found that people in richer neighborhoods coped alone with inward coping, truncated mutuality, and burden exchanges. People in poorer neighborhoods cope together with outward coping, full mutuality, and joyful exchanges. What does that mean? For those of us who are joining online, you can, who are joining in person, you can take a look at our poster. And for those of us who are joining online, we will be sending you that poster soon. So one of the things that really struck us was, for example, if we just take a look at self-assuring expressions and turning to the arts, two of these lines here, we will see that people in richer neighborhoods tend to self-assure in a way that says, I'll say it's not difficult. I'll not say it's difficult. I'll say it's not easy. I'll not say it's difficult. I'll say it's not easy. So that's how we self-assure. But people, which is great, right? Because I'm pretty sure that's one of the self-care techniques that Lysandra will be sharing with us later. But the different ways that people in poorer neighborhoods, if you just have two categories, the way they cope is more coming together and entertaining one another. So this sense of cohesion is much more there, and that showed up in our quantitative findings as well, for those of us who are a little bit suspicious of qualitative findings. And we found that poorer neighborhoods predicted better mental well-being because of cohesion. There's partially mediation, and then there is a full mediation of social experiences as well. So if we have better experiences at home, we have fond memories, that fully explains the relationship between why people in poor neighborhoods might have better mental well-being. So that is the first project that we did. And the second project, we dug into further to find out what can we do? Like, if we know this, and we know that there might be a need for community building, there might be a need for connections. Maybe my neighborhood is not as cohesive as I imagine it to be, and it's hurting seniors who are living in that neighborhood who are not so connected. So we try to explore some solutions, and in this project we then went into the community and we asked seniors what they think of this place-based framework. This place-based framework is called CAP, Cohesion at Homeness, Playfulness. So based on environmental gerontology, community psychology, and also occupational therapy, we believe that these are three variables that have impact on how communities can respond and protect their brain health. So the question now for some of us in this room was, what does this have to do with brain health, right? And that's the surprising thing we found as well. As we go in with focus groups into the community, we found that when seniors talk about brain health, they don't think so much about the neurological parts, but for them, it is really a lived experience. It is tied to the emotional and social well-being. So imagine your grandparents or your parents, and if they have poor relationships with children or their grandchildren, then there's a tendency for them to deteriorate faster. So we have a lot of this kind of evidence that are coming up, and we know that going forward, we will need to be able to do this to go to the next frontier of preventive community care. And here I want to share with you a video. I invite you to imagine a different kind of community.
I am born in Vancouver, so my parents are from Hong Kong, and I'm the middle child with two other sisters. I have been working at Frog Hollow for about 5 years. And currently we're doing a lot of projects on decolonizing work. And so I am very honored to be able to be connected with that work and with communities. We're working on multiple things. The name of the project when it first began was called the Frog Spirit Project. And in Coast Salish, we had a name gifted to us by an elder from Musqueam, Elder Shane Point, and he kindly gifted us with the name Wakasale, which means frog spirit. And so that began in 2019, and the project is essentially a way to motivate the community and educate and inspire the community to think about our way of living and our systems and how we can live in a more Indigenous led way with the Indigenous worldview guiding us with the principles and the wisdom that is still here in the community.
Yeah, I love gardening, especially when you've got a group. I found that this, interaction with others, similar, right? People with similar interests. It's amazing. I really appreciate this, the friendship that we built.
But my name is Magda Kaczmarska, and I'm delighted to be here today with some of our participants from the Brain Health and Community Stories in the Moment for All.
For me, the most intriguing challenge is that what's being studied here is not necessarily the activity, but rather the coming together to do activity and how that impacts our brain health. And so for me, that shifted the focus away from the dance and more to how people are interacting with one another, both through dance and in conversation.
The prompts were a sentence about you and your origins, a sentence about your favorite memory, and then a sentence about how you're feeling lately or right now today.
The one that stuck with me is the portrait. Someone mentioned about being a baby and with a bomb overhead and the mom carrying the baby to the cellar to safety. And I thought, wow, it created such a powerful image.
When you develop friendships with people, you get to choose to share your deepest emotions and fears and what's going on for yourself, because I think there's various levels of friendship. So when you meet somebody, you're not always comfortable about sharing what's going on with yourself, like the real stuff. But as you get to know people and you develop a deeper relationship, then you feel more able and willing to share what's really going on. So these kind of groups they're not counseling, right? But they're support services. It needs to be connected to either community centers or other kind of public facilities, because then it's open to everybody.
It was quite nice after the program wrap up to come together with Dan and actually physically meet people and have lunch together. That was a really lovely thing to have happen, because we got to know each other a bit on Zoom and we're able to build on that over a social meal. There were other people from like the gardening group and the reading group as well. But yeah, there was folks from our group, and so yeah, it was a nice mix, because when we were talking about things, people brought the program experience that they'd had to our discussions.
A bigger props to all our contributors to this video and our participants, some of whom are in this room today. So we ran this three component program, gardening, mindfulness, and also dance, to address cohesion, at-homeness, and playfulness, the three factors that are theoretical that we found before. And this led us to this our analysis led us to this finding. We had hypothesized that cohesion is the factor that will increase due to horticulture. And so people who are less cohesive, maybe they can be recommended to horticulture therapy, which is the gardening therapy. But we didn't find that. Instead, we found at-homeness, people who are lacking in at-homeness, which is a sense of psychological safety, can be recommended for mindfulness reading group, which is the group that we heard Celia talked about before this. And surprisingly, what horticulture helped with was this playfulness. So seniors who were there, some of whom are here today, hi Celine, we really enjoy trying new things, and Sophia too. Yes. So that's what we found. A little bit different from our hypothesized findings, but really promising. And you see highlighted here playfulness, and that's fun-seeking motivation, and that becomes really important. If you do not control for that, everything else changes. So that means it's possible, right? It's possible to change our perception of what aging is, and you'll hear more from the BC Brain Wellness later from Elaine, and about how this thing can proceed from here. Of course, our funding has run out, so we cannot continue the funding as much as Xavier and other people call for more activities, including dance. So there will be continuity. And here is how we are thinking about mobilizing this knowledge. So we know that this CAP model, cohesion, at-homeness, playfulness, work to some extent, and we can use it to build community, and we can use it to measure what exactly is lacking in this particular community and how we can build it and how it might actually benefit. So we're talking about a really big task, and to reach isolated seniors, and we develop a very tiny component of what might be possible to help facilitate these transformations. And this thing alone is not going to be the solution. There is no solution. In fact, solution might not be the word for it. And in fact, it's a multi-component partnership. And we're very glad that Old Ridge Fairview seniors are coming together, stakeholders are coming together, like Van Dusen and Mapo Old Ridge family place, Andrea, who is joining us online today, and a few other stakeholders are coming together to find out how we can go forward together, how we can direct isolated seniors to not just become service recipients, but to have opportunities to build relationships with other seniors and develop that mutual support that we found lacking in our first study. So long ways to go, and our engagement efforts tell us that we will need to do a lot more to one day get there, but we have promising results meanwhile. I'll quickly wrap up now. So that's the part that I already explained to you. And here we have social health innovation programs. Please feel free to scan the video links to learn more from the experts. So we have Professor Amani Kazanjan on peer navigation for cancer patients, including seniors, mainly prostate cancer particularly. And we have Dr. Melissa Lam, who piloted PARC prescription, the second PARC prescription program worldwide, and it's taking up. So there is a lot of desire from family practices to introduce not exactly new treatment, but things that we know all along, that nature helps with social health and mental well-being as well. And we have Dr. Cresswell, who led the BC Brain Wellness Program, fantastic continuity program for people who are looking for more. And finally, we have a JSA, Grace Han, with seniors peer support. Not exactly new, but it has been there, and it has been such a powerful way of rethinking aging. So thanks to everyone who are connected to this organization. So I'm going to stop here. I'm going to invite you to scan some of this to learn more. And meanwhile, I will turn over the time to Dr. Grace Park from Fraser Health, who is joining us live here. I have actually one short video from success on social prescribing as it is now, and I will show that, and that should add to the discussion a little bit more when Dr. Grace Park come and share how health and community sectors can be going forward together. So that's the exciting part.
Hi everyone, my name is Ray. I'm a community wellness worker from Success, and I'm running the Prescribing Wellness for Older Adult program. So today I would like to share a story about one of our senior. For confidentiality reason, I'm just gonna call him D. So D is 61 years old and had been living in Vancouver for over 40 years. He was referred by his wife's case manager as he is the primary caregiver of his wife, who has Alzheimer's, and he is visually impaired. D plays xiao, which is Chinese vertical flute, and he loves Cantonese music and opera. He used to attend a meetup group for Cantonese opera lover and plays xiao in the band. However, the group has closed down during pandemic, and D has been facing many barriers to stay connected with the outside world due to his visual impairment. He was also burned out from the intensive caregiving for his wife. D was referred to me during lockdown, while there's no in-person program available in the community. So I started weekly phone visit with D. D is very talkative and have many thoughts he wants to share. Besides the phone visit, I also referred D to the Cantonese Senior Phone Support Group, so he has the chance to socialize with his peers. And Alzheimer Caregiver Cantonese Phone Support Group, he can connect with other caregivers and learn to better support his wife. D is very interested in topics about health education and science, so I signed him up with online workshops that he can stay tuned and learn new things at home. D is also referred to culturally appropriate meal delivery program and produce bag program, so he doesn't need to worry about shopping and cooking. Besides that, D is also matched with our volunteer wellness buddy. The wellness buddy will call D once a week for the phone visit and build up the social connection for him. When in-person program resumed in the summer, I accompanied D to the gardener hangout and he enjoyed it a lot. And that was the first in-person activity he attended since pandemic. He said he was really happy to be out in the community garden to smell and touch the plants and to chat with other gardeners and make new friends. D is currently attending senior day program at his local community center with his wife. The Cantonese opera group also resumed, so he is attending it twice a week at the moment. D said the Prescribing Wellness program gives him the social connection and support he needs, especially during this difficult time. He is also glad that the wellness worker is able to provide him with the culturally inclusive services he was looking for. D said he feels more confident in attending community programs and activities, and he's also encouraging his wife to explore them together. So yeah, this is the story about D. Thank you.
If you are part of a community sector, that will be one best case scenario among many other scenarios. And so here, let's put our hands together to welcome Dr. Grace Park, Director of Community and Home Health. Dr. Grace Park is a champion of social prescribing and has been mentioned many times in various publications and reports on social prescribing. Dr. Grace Park, please.
Hello, everyone. Nice to see you here, and those of you online, welcome. Thanks for joining us. I've come to talk to you about social prescribing, but I wanted to tell you a little bit of background. I'm a family physician to start with, and I've worked with patients as they aged over the years, along with their families and their caregivers as well. So I've walked the journey with many patients that are aging. I also have family members that are aging, my mother in particular, who's 86 and elderly in the community. But I also have a role in Fraser Health and have had for about 12 years as a medical director for community health services. And that's where we provide services in the home of many seniors as they start becoming dependent on others for care. And looking at that side of aging has led me to really want to do things to try and prevent some of that aging process, some of the frailty that develops. So my first slide, if you can find it. So my background is in health, but I really wanted to look at healthy aging. And the next slide shows the aging process does not have to mean frailty, because we do see frailty more as people age, but we don't necessarily have to become frail. And that was the key finding in my research and the thing that motivates me every day to do the work that I'm doing. So as you age, you can look like the gentleman on the left who's starting to become a little bit frail. He might be called pre-frail or early frail. He's not really dependent. He gets around, but he has a cane and he's a bit slowed up, probably not enjoying the best life at that point. But the woman on the right is the one that excites me because she's decided to stay active and engaged and obviously having a great time, probably with her grandkids. So being frail is something that we're seeing more and more that you can prevent, because frailty is a medical condition and you don't have to get it. It's prevented by identifying things that accumulate over the years to make you frail. So if you're younger and you start getting things wrong with you, you'd want to fix that. Well, you can do that even when you're older. So you look at all the things that are going wrong with you, and with proper help, you can actually do something about that. That's what we call care planning. But when we look at care planning, we have to look at social care planning as well as medical care planning. And that's when we started looking at what makes a person healthy and whole as they remain independent in their caring communities. And the next slide shows the blue zone. And I'm sure you've heard of the blue zone, where many people live beyond the age of 100 with really good quality of life. Being frail or even pre-frail makes one more susceptible to have hospitalizations, depression, dementia, and even, not live as long. People in the blue zone live longer, but they also live good quality years as well. They have less incidence of dementia, Alzheimer's, less incidence of cancer, cardiovascular disease, diabetes, things like that. And people have that quality of life not because of a great healthcare system, because these zones are all over the world. They live that quality of life because of their lifestyle, and their lifestyle includes a really great diet and socializing and a community that makes it easier for them to live that quality of life and healthy connections. So the social prescribing work that we've started was in looking at how do we prevent frailty and looking at the social care planning that I spoke about. So in Fraser, we have created, along with the support of United Way, a role called the community connector. And the lady that was speaking in the video just before me from Success, she is a community connector because she receives notification that these seniors might be vulnerable because of some social incidents in their lives, like they may have lost their spouse recently, or they've lost their jobs and have financial concerns, or they've lost their driver's license and have no transportations, have lost their independence. So that connection creates a place and time where an in-depth interview can occur to really understand where that senior is, what the losses have been, what the senior's strengths are, and what might be acceptable to them in terms of connecting to the community. Because we know there are a few things that can be done to prevent frailty for that person. And if you don't help them, they will spiral down. So we have connected with the community organizations with the support of United Way. So to create it, we've created these community connectors in each of our 10 communities in Fraser Health. And then we've gone over to the healthcare providers section, worked with primary care practitioners, the family physicians and nurse practitioners, as well as people in the community health nurses, home support people, the assisted living sites with their community health nurses, as well as through virtual care. We've connected with all those practitioners to help them to identify seniors that are becoming at risk of developing frailty and going down that path. So they actually make a referral directly, and we have one point of entry in each community for their seniors community connector. So then the connector calls the senior and their caregiver and invites them for an interview. And it has to be acceptable to the senior. So it might be just a coffee, or it might even be just a phone conversation. So whatever it is that the senior is willing to participate in, that's where the connector will find an entrance to be able to start looking at their lives and then developing some goals as to what's acceptable to the senior, what's important to that senior, and then developing a shared wellness plan. And then she follows them over time, developing that relationship, setting goals for them, and overcoming barriers such as transportation or finances, whatever it might be that's getting in the way of them connecting with their communities. And doing that over a period of time, the senior then is exposed to all the resources in the community that the connector has access to and is aware of. And these are resources in the community that the healthcare providers do not know about. They don't really know about what resources there are. They just know that there are social issues that could help, that are affecting the senior's health. So that's when we get that connection to the community, and we have developed a feedback loop from the connector back to the primary care practitioners and the healthcare providers to say, we've seen your patient, your older adult, and we've connected her to these things, and we're going to support them until they feel independent to carry on. And through that feedback loop, we're supporting the primary care practitioners, healthcare practitioners, to continue to support that connection to the community as well. So there is a way of avoiding frailty, and this is an easy acronym for everyone to remember, and it comes from the Canadian Frailty Network. A is for activity, saying exercise at any stage of aging is helpful. It'll improve your ability to function, be mobile for as long as possible, and it's never too late to start. And vaccines have had a really high profile over the COVID period, but there are other vaccines as well that can help the immune system for the senior to remain disease-free. To avoid disease is the best way to go through vaccines. O is for optimizing medication to ensure that people are not on any drugs that are not necessary, that they're on doses that are appropriate for seniors as they get older. So optimizing medication, avoiding polypharmacy is the O. And I is for social interaction, avoiding that social isolation that we know is so harmful to a senior as they get older. And then D is for diet, using food as medicine as you get older. Protein is so important. Vitamin D is so important for seniors as they get older. So AVOID is a simple acronym, and we're going to be seeing more and more of that in the public world. Yes. And so this is the last shot that I have from the healthcare sector. This was the hallway at a hospital that I work in, and you can see this is a hallway, but this is the emergency department. There are no beds in the emergency ward, and so patients are just lined up against the wall in the hallway. You know, no dignity whatsoever. Patients are being examined and cared for in this setting. And we know that frailty patients are 1/3 more likely to stay longer than 30 days in hospital. And we also know that 1 out of every 3 beds in hospital in Canada is taken up by people that are frail. So things that we can do to promote healthy aging by connecting to community services to support healthy aging is really the only way to deal with the situation. And I will stop there. Thank you.
Thank you, Dr. Grace Park. May I invite you to stay a little bit? We might have some questions for you. Could you try and grab a chair for yourself? All right. Okay. So while you're getting comfortable, maybe we'll just look around the hall if anybody has any questions before we go to the questions on the chat. So we were going to take about 5 to 9 minutes or so for questions. Any questions about what we've asked so far? Maybe for Dr. Grace, maybe for myself, or anybody in the room actually. All right, so I guess we have some questions from online. Take it away, Margaret. Thank you so much.
Hello. Oh, hello. Hi, everyone. My name is Margaret Lin. I'm a project lead with social prescribing with Dr. Park here. I'm just going to read out a few questions online. So the question 1 is, are there any SCC, so Seniors Community Connector in Vancouver? And the following question is very similar. Who are they and where are they? And a list of all of them would be very helpful. So that to start for now.
So I guess the
Mic would be helpful. Yeah. So I work in Fraser Health, and so I don't know a lot about the Vancouver area. I know of one in the Collingwood area because I was at a presentation with the connector there, and that program was very well established and sounded fantastic. I'm afraid I don't know of the others, but I think there are about 4 SCCs in the Vancouver region. And probably the best way to find out who they are would be to go to United Way, or even go to the pathwaysbc.ca and put in your community and social prescribing and see if there's anything there. Definitely there for Fraser.
Yeah, so probably 2 methods. If you live in the Vancouver area, if you type social prescribing or even community connector on Google and Vancouver, there should be 4 available.
Yeah, I actually can name them for you now.
Sure.
So we have our West End Seniors Network, that's one. And then going from west to east, we have Success. And then we have, that's a Chinatown. And then we have Frog Hollow Neighborhood House. And then we have Collingwood Neighborhood House, which is near Joyce.
Yeah, and we encourage you to reach out to the one that's nearest to you where you live. Because then the resources would be near where you live. And if you are in Fraser Health region, there are several ways to find out. One is if you visit a website called pathwaysbc.ca, and it's a platform with all the community resources compiled, and you can look for anything you'd like, including social prescribing. And the second method is you can go on the Fraser Health website. If you type in the SCC, so Seniors Community Connector, there is a whole list of which organizations they are, and also the contact info, and you'll be able to reach out to them.
Can probably take another 1 or 2 questions on the overall program. Just to let you know, after this, we will have 3 breakouts into linkage or between health and community sectors. And there you can have more extensive discussions with Dr. Grace Park, Margaret and team. And also there is a self-care techniques workshop for people who sign up online to join, to learn about self-care techniques. We also have some resources here for people who are here in person. And that's with Lysandra, registered clinical counselor at Frog Hollow Neighborhood House. And finally, we also have an Oak Ridge Fairview community building team facilitated today the conversation by Aymara and Andrea. So any further questions before we break?
So we do have 3 more questions 3 questions about social prescribing and 1 hands up. Yeah, will we have time to address those right now? Okay, Larry, if you're online, I see you have a head.
Yeah, thank you, Grace. I find that SCC is a fantastic solution. What disturbs me is 2 things. Number 1, the quantity. You mentioned a number of 4 and whatever it is. I do believe that every single senior, because of the fact that the SCC is an advocate for the particular seniors, every senior should have one available at any time. And I think it's a fantastic concept that's absolutely necessary. The other thing is, in conjunction with that, is how do we discover and expose those isolated seniors, you know, the ones who are capable of accessing through internets, etc., is simple. That's the low-hanging fruit. But the truly lonely and isolated people is the problem, and somebody has to be able to expose and discover them. Is there any thing in operation at this point that addresses that? Thank you, Doctor.
Thank you so much, Larry. You should come on a walking talking tour with me, because you've highlighted all of the things that I speak about.
When do we leave, Doctor?
Yes, well, we'll figure that out.
All right.
I think, yeah, and I agree with you. Every senior needs access to a seniors connector who is an advocate for their lifestyle, to improve their lifestyle and reduce barriers for them. The issue of social isolation is one that is, you know, a topic of study everywhere. And I've tried to think so hard for many years of how to reach those seniors who are socially isolated, because they have personality profiles that make them isolated. And a lot of them don't even come into their family doctor's office, and you don't even hear about them until something goes terribly wrong. But there are things that are risk factors for social isolation. And so that's one thing that we look for as healthcare providers, is if a person has lost a spouse, that's a risk for social isolation. If a person is in a small social network, if they're in a rural community, if they're of a smaller ethnic community, they're at risk for social isolation. And in medically, if they suffer from chronic conditions, if they've got mobility issues, if they have mental health concerns, if they have cognitive decline, these are health risks for social isolation. So if we go to the healthcare providers or anybody that sees seniors on a regular basis and say, these are the things that are red flags and you should be looking out for them. And if you see that, make the referral to the connector, to the SCCs, then that's a way of getting to them before they become isolated, perhaps, hopefully, before they become too isolated, and then offer them the support in a very tailored, supported way that's acceptable to that individual. And we know that cultural barriers, language barriers exist, financial barriers exist, psychological barriers exist. And that's why we need that one-on-one person-centered approach. And that's what we are doing with our SCC. So we've just started this work, Larry. We've been at it for a couple of years at Fraser Health. United Way has been funded, to provide this. And we hope that this is going to be something that will continue and hopefully to spread throughout the province. And so really great to hear your thoughts on that, and hope to have your support as we, try and advocate for more.
Of course, thank you. And the question too is, on a philosophical basis, are we in fact our brother's keeper? And I say that we are, and I say that neighborhood has to be redefined right to the point where a neighbor, the word neighbor has to be redefined. And we've got to start at the grassroots. You agree, Doctor?
Absolutely. And I've spoken with a group on Gabriela Island, and they have a program called Neighbors Helping Neighbors. And I use that phrase all the time. And I think, taking the medical model is only a tiny little drop in the bucket. You need the whole community, you need the connections, and you need your neighbors to help you through.
Thank you. I think on that note, we will have one last question from Professor Andrew Wister. And after that, we will take a break and we will go into our breakout rooms. For those who are joining Linkage, please stay in this room. And for those who are joining the self-care or the Old Ridge Fairview breakout, please go straight left through this door, straight for the Old Ridge Fairview, and then left for self-care techniques. If you're joining online and you need help getting into these breakout rooms, please indicate in the chat two for which one? 2 for Old Ridge Fairview and 3 for self-care. Is that right? Okay, thank you so much. Final question from Dr. Wister. Thank you so much, Dr. Wister.
Thank you, Daniel, and thank you very much, Dr. Park, because that was a fabulous presentation, and I love the program. And Larry, your comment and question actually was mine, because I'm very interested in social isolation. And the other side of that is resilience and bouncing back from various kinds of adversity, including social isolation, especially during the pandemic. So I just wanted to make a couple of comments because my question was pretty much answered. And the first one is that we are working, we've put together a large consortium of individuals on a SSHRC grant, Social Science Humanity Research Council, which we hope will get funded next year. This involves people from BC and Quebec, including United Way, Costco, many organizations and academics and similar organizations, Alzheimer's Society, similar organizations in Quebec. And the idea is to address social isolation, focusing on especially those individuals who fall through the cracks. So these are the exact individuals that Dr. Park referred to. I don't like to use the word vulnerable, but maybe marginalized, high risk. I mean, we have to be careful with words. In any event, we're hoping that gets funded, and the whole impetus of it is to connect organizations. There's about 700 organizations in BC and Quebec that provide some kind of service to older adults, but a lot of them are very small. A lot of them are fragmented. A lot of them don't know what the others are doing. Some do, some don't. So I think to respond to Larry's comment and Dr. Park's response is to what we need to do is connect those organizations so they can share, so they can build resources, leverage resources, and so we can reach more people and share the innovations that are taking place. So this is a wonderful program that I bet other organizations could adopt. And so that's sort of the next step, I think, where we have to go. The other thing I wanted to say is that for those who are involved in community groups around this table and online, there's this program called MyTax. And what it is it's a large government-funded program. And if we have lots of students in the graduate programs here in gerontology who would love to work on research projects with you, you being the community groups. Now, in order to access the funds, you would need to, it's a matching situation. The smallest amount I think is around 5,000 or 6,000 that you would need, and that gets matched, but it can go up to any amount, and that's for a student for, I believe, 6 months. So we have to identify the program. We write it's very easy to write these. They're almost all funded. They are almost all funded. So the issue, of course, is a lot of community groups don't have a lot of funds. They're always scrambling to get funding. A lot of it's through almost a year-by-year basis. Some get New Horizons grants, Vancouver Foundation, government, Fraser Health, other health authorities, etc. But if you can put together the small amount of money, it can be doubled up, and then you get a researcher, and it can really help in mounting these programs and perhaps even evaluating them so that we know how well they work for whom and to make them better. So that's a wonderful program, a little bit of a plug here, but if you're interested, please contact me, Andrew Wister at Gerontology, or any of the other people on faculty in Gerontology. We'd be more than happy to help you. You don't have to write these grants, and we have the students, so this is a wonderful opportunity. Thank you very much, everyone, and just a wonderful job with everybody. Really enjoying this. Thank you.
On that note, the tools and the resources abound, and so we'll take a break now. We'll look forward to seeing you in the breakout at 2:15. Thank you.
We know that exercise is good for our brain wellness. Engaging our creative core also has an equally important and positive impact on our well-being. To us, brain wellness is being creative. Brain wellness is being expressive. Brain wellness is being yourself. And isn't that what we truly want? The ability to be ourselves. This can be lost when we are living with a chronic brain condition. We become patients and caregivers, and not a person. We can lose the sense of who we are. The BC Brain Wellness Program wants to change this with their creative expression classes. These unique classes provide an opportunity to try new things or follow a passion to stimulate the brain and make a positive impact on well-being. Perhaps it is refining gardening skills, or joining a singing collective, or creating a piece of art. These experiences provide an incredible feeling of achievement, of living, of being you. Find your creative expression and take a step towards brain wellness beyond all boundaries.
Hello, everyone online. Can you still hear us okay? Yes, I see Elaine's thumbs up. Thank you so much. Yeah, so I guess we have officially started session 1, breakout room 1. Is there any questions that you have before we answer any of the previous one? And in the chat box, there are the links. So the first link is for well, you might see that there's all Fraser Health logos at the bottom, but we sure hope that the info is applicable everywhere. So the first one is about the social prescribing poster. We can post it anywhere. We share with the doctors, so hopefully they can put that in their clinics. So it's really is just what a seniors community connector. And this is some of the resources the connectors can help you connect with. And then action items. So ask your family practitioner about getting connected. Or really, if you really want to, you can also connect. Well, the client can also self-refer. And it is publicly available. It's on this web link and the number. So if you would like to download it and access it, please do that anytime. So that is the first one. And the other two that we have, let me bring this out. Are hard copies of the posters. Thank you, Elaine. Are hard copies of the posters available November 5th and 6th? So the next weekend, it is in the Vancouver Convention Center. There will be hard copies posters there to hand out. It is an event for all data related info and the job fair as well. So it should be very fun. But there will be hard copies there, but otherwise it's just on electronic format. And we hope that maybe your office or your team can make those copies, whether in black and white or in color, and to share those out. Unfortunately, we don't have more hard copies. But hoping this link can be helpful. And another one is this one. So this is one that we do plan to spread it as widely as possible, hopefully in grocery stores, just in your community, could be in casinos, could be in a community recreation center. And if you would like, you can definitely print these out or share these link, and then just post it whenever, wherever. I have some neighbors that they are active church members and they have a great community there as well. So I plan to share with them and they can print it or bring it to their church. Can share with your friend, with your family. But this is really a poster to say that there are these things available in the community, and really you can just call 211. And 211 can offer different languages as well. So they also have Mandarin, they have Chinese, they have Korean, they have Punjabi, Tagalog, over 150 languages that I don't know all of them. But it is there. So really encourage you to call that number. And also there is the third one. I feel like I'm just doing a marketing promo here. But we did develop these because we know there are so many great resources available. It's just sometimes it's so hard to know where to even start. So we hope this can be helpful. So this is a pamphlet format that you can also print out. On the front, it looks just like the poster. And inside, it actually says more, what do we mean by there's transportation services? What do we mean by there's physical activity services? There can be newcomer support, language support, skills training, indigenous programming and resources. So it really is just a pamphlet with everything in there. And hopefully that can support many people. Is there a missions community services role? They run the Better at Home program. So for that question, yes, indeed, there is a mission seniors community connector. And if you go onto pathwaysbc.ca, or if you go onto the Fraser Health website, you should be able to see the phone number for the mission connector. And there is a second question about the differences between 211 and SCCs. Okay, so BC 211 is actually a phone number, just like 811. 811 you will call more for health or medical questions, and 211 is for anything social resources. So you can text or call 211. And if you're looking just for a number to call, like where can I find volunteer drivers? Where can I find Meals on Wheels program? Where can I find caregiver support? Then 211 is a perfect place that can give you their contacts. If you or your loved one or a friend, they need more hands-on support, so they would really like someone to be with them and handhold them and explore with them what services they need, or actually sign things up for them, then the Seniors Community Connector is the way to go, because they will be able to be there and talk with you and follow up with you and make sure everything's okay and remove any barriers you have. So that is the shorter version of that answer.
Yeah, it's on. So I was just going to add, thanks, Margaret. I was just going to add that if you call 211 and say that you really need help to even be able to connect to some of the services, then they'll just refer you to the connector. So what we want to see is 211 is a collection of resources and numbers in your community that if you had the ability or you have somebody who can help you to call those places, and you can just go ahead and do that. But if you are not able to navigate, say, a website, you don't really have the ability to, call those things and ask for the correct things, and then you would be referred to the connector. So the 211 people actually have a listing for all.
Thank you, Grace. Let's see, what else? Anyone online right now in the breakout room with us have any questions? Or any comments, really? Or if you have any stories, any barriers in your community that you're not sure how to link people or where? Yes, Elaine. Thank you.
Well, I just thought I would take this opportunity to just share a little bit more about the BC Brain Wellness Program. I just want to clarify one thing that was mentioned earlier on about it kind of just being in for Vancouver, the Lower Mainland, and in fact it is the BC Brain Wellness Program. So because of COVID and 98% of our classes are on Zoom, it really is designed to be accessible to anyone in the province. And we do have people who are Zooming in from the island and from up north and really all over the province. And so I just wanted to reiterate that it is a BC-wide program, and currently majority of our programs are online. And happy to answer any questions about the program if anybody has.
Thank you, Elaine. That's a great plugin that I don't even know yet. So thank you. It's great to learn that. I'm just looking through the chat box right now, but I think a lot of people who asked the question are not in this room. This is interesting though. So Grace, are there any plans to create a digital social prescribing platform that integrates with the EMR, or that can be used by community providers or prescribe across communities and providers? So integration of social prescribing referral and EMR.
So is this EMR in medical offices? Just need that clarification.
Probably. It didn't specify, just EMR in general. Can this referral, I guess, as soon as that's documented in EMR, or the doctors can refer digitally to social prescribing?
Yeah. So from family physicians' offices, they can go on to Pathways website, and most family physicians in BC have access to pathwaysbc.ca, and they can just go directly to social prescribing in their community. And most of the communities, well, certainly in Fraser, all the communities are posted. In Vancouver, maybe hit and miss. The rest of the province, there are some communities that have social prescribing, and that might be in Pathways. So that's something that physicians can look, or they might just have to Google social prescribing in their community and see if there's connections. In smaller communities, the physicians are very aware of the local resources, and so they might know if there's a a point of entry or a connection point for the local organization. So that might be just a telephone call, or they might have a referral process already established. But going from the EMR, I think it's more, so they would document in the EMR, and then they would have a referral through pathways that can be done electronically, but that's not directly in the EMR per se. Are we working on a platform like that? That would be a dream. And one day we might get there. And certainly in Fraser, we're looking at electronic platforms from community health offices. So home care nurses can actually, we're actually building a platform that they can refer directly from. That's Paris. So that might be coming.
Any other questions or comments? Anything you'd like to share? And
I was just going to respond to Gloria's comment about advice for reaching out to healthcare professionals to get them on board with social prescribing. I think that that's just such a challenge. But I think getting the word out, doing things like this, and then there's hopefully a ripple effect, because I'll take pieces of today's talk back to my team and share it with 8 of the neurologists that I work with. And I think that's where they just then refer to me as the social worker on the team to keep all of this knowledge in my head and disseminate it. But I think, even just getting it out to our team members, to the physios, to the OTs, to the people working out in the community, that would be really helpful.
Yeah, I absolutely agree with that. And I think the more we do in terms of just spreading the word, raising the profile, making social prescribing a common vernacular so everybody knows it, they can then take it to their healthcare provider and say, okay, I want to know about social prescribing. Can you make me a referral to social prescribing? And then if they say, what is social prescribing? Well, it's on them to find out. So getting the information out to community in general, to the older adults in general, is really helpful. And then certainly to healthcare providers and social workers like yourself, for sure, is a way of spreading it as well.
yeah, and in terms of ICE and Senna, thank you. Just want to add on to that. What we are doing is part of our role is we meet with different healthcare providers in different settings. So either they're in primary care clinics, either they're in assisted living, maybe they're in hospital, maybe they're OT or social workers in the community. We talk with them about social prescribing and actually do that support piece, like where should you go, how do you refer, who do you refer, where are these services, etc. And I'm aware that that's so far happening more integrated in Fraser Health, but we do hope that that news can come out through events like these, or any possible events that we have. For example, last week we did a public presentation with the Providence Health online, and that recording is still on there. It's accessible for all the public. And so on social prescribing, and just like Grace said, we want to not only share this news with healthcare providers, but we also want to empower any of the seniors in the public so they can bring this news back to their care providers. And that might be even more powerful than us reaching all the healthcare providers, because there's just so few of us. So if all the public members, the seniors themselves, the family, friends, neighbors, they can all become champions, and they're actually managing their care, and it's can be a very empowering process. And I'm just going to share in the chat box in a bit that in addition to the social prescribing posters we do have actually, and we actually have another resource that we developed recently for signposting. So it's about it's like a one-stop shop poster on where to find community resources, and it's mostly either go to 211 or go to social prescribing, and it also lists out what do we mean by community resources. And we're hoping that if you're hearing this right now, if you could even print it out and then spread the news. Can be in the grocery stores, it could be community center, it could be a doctor's clinic, anywhere that older adults are, which we know is really everywhere. So that's one of the methods we really want to try to spread the words.
So with you trying to expand social prescribing and giving it out to healthcare providers, as the program expands and you have more of an outreach, is the plan still to have just one community connector per place? because I know you're saying that for each person, it takes a long time to get to know them, to kind of have a specific plan for them. But if it's just one person in each community doing this, and as you expand, would that start to pose a problem? And as you expand, having multiple connectors in a community, is that also an issue? And logistically, is that something that is possible to expand to a bigger scale at the moment?
Thanks for that. That's a great question. So we are finding in some communities that the one community connector role is oversubscribed, and we've seen it in other programs as well. And so they have to go to wait lists and whatnot, and we don't want to see that happen. And so like any limited resource, we try and leverage it as much as possible. And so when we started the signposting with BC 211, that was a way of providing lists of resources to people who are able to access them themselves. If they can work a website, or if they can talk to somebody on the phone, they can make those referrals on their own. So that's BC 211. And then if they need extra help and they really don't know how to access help, that's where the connectors come in. So we're sort of looking at those that are sort of at the highest need to be the ones to connect with the SCCs. But even at that, it might be too much in any one given community for the one role. So we're looking at expanding other ways of connecting seniors that are marginalized or at risk through other channels. And so that's going to be the next, I think, evolution, to see how can we take this role and turn it more into a more broader community outreach type of work. And I think that's what our professor from SFU was talking about earlier, by connecting the business network like Costco and other organizations that are, they see seniors coming into their facilities all the time. Can we leverage what they've got in terms of resources to be able to do a more of a community awareness for older adults, and then identifying people that may be isolated. So it's to come, but we've just started the journey. Thanks.
Hello.
Yes, Ian, we hear you. Thank you.
Okay. So it's not really a question, but in Richmond, you have individual connectors, but in Richmond they've got a Chimo Community Services, which is an organization. It's not dedicated to seniors, but the sort of advocacy and connection information that you're talking about, they have and use through a whole team of people. So it's not an individual, but it's an organization that performs a lot of these functions for the whole community, not specifically dedicated to elders. I'll put the link in and you probably can know about that.
Yes, thank you. And every community has, nonprofit organizations like that one. And there are many other resources there in the community. What we've done is gone to one community-based senior service organization to help us with our program. And so we've identified just one organization and then put in the role of the seniors connector. But there are other organizations that provide full spectrum of services for kids and to adolescents, to seniors, etc. And so those are available in many communities, and it's really great if you're in a place like Richmond where you've got that. So yes, we are aware of those. It's just the program that we've started in was with one organization that was serving seniors because the funding was for a healthy aging program.
Thank you.
Yeah, and also social prescribing is indeed not just for older adults. It originated in UK, and it is a term that is adapted very differently depending on your country and province and city. So Ontario, they also have social prescribing programs that are not restricted to older adults. And some of the things they prescribe can be going to a museum, going to a park, that ties into park prescription, or going to a community activity. And it's just more here in BC that due to the funding nature of it and the restriction, that is for older adults mostly, and is for community resources instead of, say, like a museum prescription. Hopefully we can have that soon. That sounds very fun. But yes, it's just defined differently, and we're hoping it can expand in as many ways as possible.
Thank you. So I'm not sure, well, first of all, very grateful for the opportunity to participate and learn from such a diverse group of knowledgeable people. And the question I have is, there was a brief mention at the beginning of Linda O'Day and residential schools. And I wonder if any of you in the room know like specifics, like a link or how a name is spelled and all those things, so that I can follow up on that and see a little bit about that material. Thank you.
That was from Andrew, the head of the gerontology program at Simon Fraser. He did have a master's student who was studying, I think did her master's thesis on residential schools, and it was Linda.
Do you know how you spell her name?
All right, that's Day, D-A-Y.
D-A-Y, okay. That helps.
Sunday.
Yeah. Okay, thank you.
I think that's the end of our session, I believe. Okay.
We had originally planned for a report back, but just because there's discussion is still going really hot in other rooms. So I think we will end it here today. Thank you all so much for tuning in and for your active conversations. I hope it has been helpful for some of you, for most of you, I hope. And yeah, please feel free to send any questions that are unanswered to me, drgan@sfud.ca. If you want to direct it to any specific persons, I will please state that, and then I will try to get the answers back to you. Thank you all so much for joining today. Celine and Sophia, any thoughts? How about Richard? Just give the floor to you before everybody signs off. Oh, Richard asked questions. No more talk time, Richard. Sophia and Celine, yes.
Yeah, very nice to attend this workshop, and very nice to listen to Dr. Park. Yeah, the speech is really welcome, and to enjoy those resources for the senior. Yeah, very good. Yeah, thank you, Dr. Gan.
Very glad to facilitate this conversation, and yeah, Celine's a nurse herself, a retired nurse, and wonderful one, and everybody wants her back. And she says, no, I'm going to be selfish in this golden years. And I support her. Sophia, any word from you before we go?
That, I really appreciate Dr. Park's speech.
Oh, they love you. You should take a photo together. All right. Okay. Bye, everyone. I'll let you go. Take care all. Thank you for the work you do. Bye.